Hey, Diane, thanks for meeting with us today here at Tender Care. You're one of the more seasoned nurses here. You've been around for a long time and, of course, been a
Yes.
nurse for many years.
Yes.
And I'd just like to ask you, what are your thoughts on the kids here and the nurses here and what you do every day?
Well, I have to say I've been a nurse for 25 years. I started off in elderly, and I did that for a year, and ever since I've gone to pediatrics because for these children, I just feel like a lot of people do shun them, and just throughout history, they've
Mhm.
always been looked at aside. And I really want them to be integrated and feel like they're part of our world, and I want them to feel included and I want them to feel special. And if I can make them smile and feel loved for the time that I'm here with them, then I feel like I've done my job.
Oh, that's wonderful. That's wonderful. Do you feel that any nurse that wants to get into pediatrics, because like we were discussing earlier
Yes.
off camera, a lot of nurses want to get into oncology, they want to
Right.
get into surgical nurses, things
Hmm.
like that. What does it take to be a nurse working in pediatrics in this kind of environment?
I think you just basically have to love children and just love seeing progression. Seeing
Hmm.
progression. It doesn't even have to be in their health because some of the children have terminal illnesses,
Sure.
but just progression in the sense that they're feeling happy, that they're feeling at ease, comfortable, loved,
Yes.
that they get the sense of touch. I think that's very important with us to
Mhm.
hold our babies and touch our children that are older, even. Um, but with the times changing, we did require some type of pediatric
Yeah.
experience, either even babysitting. But I think that now with the times changing and the scarcity of
Hmm.
nurses, I believe that they are making accommodations. So I encourage any nurse to apply
Oh,
and
absolutely.
put down any type of experience, even if you're a mother yourself. I feel like that counts as experience
Sure.
too. So even that, I encourage anyone to come. I don't even. I just if you just love children, if you just love to play, I feel like that's a good start.
And what better feeling as a nurse than to, as I'm sure all nurses feel, but with pediatrics,
Yes,
doing something that's bigger than yourself and
absolutely,
and going home every day with the feeling, like you were
absolutely.
saying, kids that come in and you see their progression. We were just speaking
Absolutely.
to a physical therapist there, and she was just telling us about how she comes once every month or so, and then
Right.
she looks at her chart and
Yes.
just sees how much they've progressed
Mhm.
in their
Yes.
therapy. It's just a
Yes.
wonderful, wonderful thing that they do here at Tender Care. And
It totally is.
sure, sure,
Yes, it's amazing. I know I can think back of many kids, but there's one in particular who came here, a beautiful child, was nonverbal and non-ambulatory. She didn't
mhm,
walk. And she is walking and talking and everything now. So it's
oh
amazing to
wow,
have seen that she came without being able to walk. And I knew that my therapist was going to be able to get her there. I just knew it from the beginning. And it's such a good feeling to know that your thoughts and your hopes for this child
hmm,
has come to
hmm,
fruition. That's an amazing feeling, not only
sure,
for us, but what a great feeling for the kids. Like a teacher with their children that they advance. It's the same feeling.
absolutely.
Even with my own, they just feel like my own kids. If they move forward, if they advance in the smallest of ways, I'm proud.
Yeah, having coming from a family that has a nephew that's developmentally disabled, my heart goes out to
Mm.
everybody on the front lines that are in the classrooms with these
Oh
kids
yes,
and have an opportunity to come and tour it and things like that.
they're a blessing.
It's such a blessing and a
They
certain amount
are.
of empathy and
Yes.
compassion
Well, they
that the
teach
nurses
us.
have.
Yes, they
Sure.
teach us too, because it's a hard world out
Oh,
there.
absolutely,
And
absolutely.
when you go out into the public, you may not always get a smile, and you may not always get a genuine and sincere hello,
Sure.
but when you look at these children, it makes me want to cry
And
because
sometimes that's all they need,
yeah,
right?
you
Just a
just look at them
smile
and you
and
smile
a
at you. You
touch.
know it's sincere. You know that
Sure,
they love you. You know that they admire you there for them. So it's just so
sure.
important. It's such a great feeling.
Absolutely.
Yeah.
Well, I'd like to thank you
Thank
for everything
you.
you do here with the
Thank you.
kids. We need so many more of you here. And just the compassion and empathy that you show and every other
Yes.
nurse shows here is
Yes.
just a wonderful thing. So
Thank you so
we
much.
really appreciate it. And I know the kids absolutely appreciate that and
Oh,
their
we love
families as
them
well.
too. Thank you
Yeah.
so
You're
much.
very welcome.
Thank
Thank you.
you.